Another 430 people seeking medical care at the hospital have been reported to the Department of Health. That is the highest one-day jump since April. But here's the encouraging side of that. Improvements in care mean that those people are not staying in the hospital for as long. So even with that jump, the number of active patients today is down to 3,157. Investigator Rebecca Lindstrom found that's good news for hospitals struggling to keep up.
Only a few ambulances have rushed to the doors of Piedmont Newton Hospital this week, but there are plenty of patients inside. For several days, the hospital was on total diversion. Chad Black, head of the Georgia EMS Association, explains what that means.
All their ICU beds are full, all of their hospital beds are full, even overflow's full, and their ER's full. They just can't take another patient.
Diversions are not new, but he says this list is longer than usual, which also shows when ICUs or other specialized services are full.
Most people are attributing it to patients that are exhibiting signs and symptoms of COVID or COVID positive.
On Monday, data from Georgia Emergency Management showed Newton Hospital was treating 39 COVID patients, either confirmed or suspected. While compared to larger metro counties, the number seems small. It is more than double what the hospital treated in the first wave of this pandemic. There is no doubt we are seeing more new cases in that county and in Rockdale, which also started to divert patients today.
There's only so many beds and people to take care of those patients.
This week, 6 hospitals have diverted patients at some point, primarily smaller hospitals in the suburbs or outlying counties not set up for a large swell. 11 hospitals also warned that while their ERs were open, their ICUs were full.
We've heard about pandemics and kind of prepared tabletops and did the exercises. But when we left those exercises, none of us really thought in the United States we were going to see this happen.
There is some relief in sight. Gainesville opened its 20-bed temporary medical facility on Tuesday. Piedmont in Midtown opens its new 60-bed space for COVID patients next week. And GEMA says the space it built in Milledgeville and the Georgia World Congress Center are ready for the governor's order. Hospitals around the state admit they are juggling ER, ICU, and general beds, trying to staff them with the real need. They say these alerts are for ambulances. They are all still taking patients that walk through the door. So if you need medical care, they say come.